Hello, my dear friends. I hope you all are doing very good. I am Navneet Misra from Navinomics, and today we have special guest Divya. She will be talking basically about health psychology. She is pursuing masters from University of Hyderabad, health psychology student, and she is also doing internship. So we'll have a lots of idea कि University of Hyderabad में कैसा department है, क्या future career है, how you will get job, what's the fee structure, how's campus life, each and everything we are going to talk. तो प्लीज स्टे ट्यून विद दिस वीडियो टिल एंड काफ़ी मज़ा आने वाला है. तो दिव्या, नाउ इट्स यू. प्लीज जस्ट गिव ए ब्रीफ इंट्रोडक्शन टू आवर ऑडियंस.
Hi all, this is Divya. I'm presently doing my master's in the Department of Health Psychology from University of Hyderabad. I just completed my fourth year and I'm in my final year right now. And we had exposure of internships in many courses which are useful for us.
Okay. So basically just tell me, as your department, how do you rate your department? Means how's the faculty there? I mean, how's curriculum there? What they teach? Are there any practical approaches or only theoretical approach? Can you just give a mix of this idea?
Yeah, so the faculty are very good. Everybody did a lot of papers, and their specialization is very high.
Mhm.
When we talk about faculty, the exposure we get from the faculty is very good because while they teach, they give a lot of examples which will make us to understand how to deal with a lot of patients because it is more of a practical kind of thing we have.
Yes, yes.
And in the first 3 years, which is the degree we do, there is lab courses we have each semester where we are exposed to a lot of different assessments which will help us to deal with our clients better.
Mhm.
So every semester we have a lab along with the theory courses.
तो जस्ट इफ आई आस्क यू को जो इंटीग्रेटेड साइकोलॉजी होता है दैट यू गॉट इनटू इन 2019, so is there any specific eligibility that only this background people will be allowed to write the exam?
No, you have to complete your plus two. That's it. Any stream is fine.
Science or
Uh,
arts, any stream, okay.
yeah, science or arts, any stream is fine. You
Mhm.
have to complete your plus two and give your exam.
Mhm.
And the intake is and the intake is 20 for IMSc, and for MSc now you're writing CUET, the intake is 15.
Yeah, so guys, competition is very tough. She is telling just 20 seats in grad level, that is integrated level when you enter, and in masters that is just 15 seats. And for masters you can write CUET exam, right? Even for the integrated now CUET exam at different level. If you want to enter as a UG student, then you have to write CUET UG, otherwise CUET PG for the masters. Yeah, that's the clear thing. Now basic things ki coming ki this is a kind of psychology course, science course. So will it be very costly or it is not costly? How's the fee structure there?
The fee structure is basic like other courses. We have like 6,300 per semester,
Mhm.
which is the same. But sometimes it might be a bit higher than the arts course, like 1,000 or 1,500 difference, because we use a lot of lab equipment,
Okay,
which
okay,
might
okay.
cost like 1,000 or something difference. But more or less, it's on the basic level only.
Yeah, and also it base this odd and even. I have seen like to now onwards you will have, I think, this even semester. So there is a slight higher fee because there is development fee and tuition fee, medical charges and all. So it's definitely approx 7 to 8,000. So I can say for masters, 8 into 4 to approx 30 to 35,000. That's
Yeah.
enough. And what about the hostel facilities and all?
Hostel facilities are good. Like we'll be provided with a two sharing room, and also there is a mess which is very nearby. And yeah, the facilities are good. We have good washrooms, and the cleaning is done very well. Like I think the hostels are good.
Especially when it comes to Hyderabad and people staying far away from Hyderabad, particularly if I'm talking North India, Rajasthan, Delhi, UP, Bihar, Jharkhand, and all. So when it comes to the girls' safety, security, ki how people can that move 2,000 kilometers. So how's campus in terms of security, safety? You being a girl, how do you feel then?
Yeah, I think the security is very good in the campus because there is a lot of patrolling that happens
Okay,
even
okay.
around 2 o'clock or 3 o'clock.
Mhm.
That we can roam very freely in the campus. There is a lot of freedom and there is security because there is always a patrolling, and you will feel very safe even if you want to walk alone at the night in the campus. And in the hostel is also very safe because you have 24/7 security outside.
Mhm. Yeah.
And also it's an open gate so that you don't have a restriction of time
Okay,
in the
okay.
entering of hostels.
So that's in terms of liberty and freedom, you have full freedom, no restriction, as you told, ki 2 a.m. night, 3 a.m. night, just be safe and you can just move out or move in.
Yes.
Yeah, next thing what I was curious. So basically, what you guys do, you have a lots of experience of 5 years. So how this psychology just different from the what you do did in your graduate course and what are you doing in masters? So is there any theory, practical, or what's the basic difference?
Yeah, so in graduation, the first 2 years, we do also have exposure of other departments like
Okay,
sociology,
okay.
linguistics. We have a lot of electives like philosophy where we can choose. So that the first 2 years, it's like a mix of all. You get to learn psychology and also other courses. And also, as I mentioned earlier, the first years of graduation, we have a lab for each semester which will make us to learn a lot of assessments related to psychology, which will help us, to deal with our clients. So the third year we'll do a research project. Like after 3 years, we can take a quit. So the research project we do in our third year is also very helpful. Like if you want to go out just after third year, it is very helpful for us.
Okay, so it's a
So
research project. Can you share any experience you had? I mean,
yeah, like there is it's more like, the research idea will be the same for all the 20 students in the class, but it's more like, you'll know how to collect the data, how to analyze it. That is what we will learn.
mhm.
And this is the 3 hours. As I said, the lab exposure is very good. We'll get to, like learn a lot of assessments. And after that, while talking about the masters, which I'm done with my first year, the masters first year, I was exposed to the counseling skills lab, which
Acha,
is
acha.
very extensive, and it is taught very well. We had one-on-one sessions, like 4 to 5 sessions, where a scholar will be sitting as a client. It's more like a stimulation kind of thing,
Okay,
where
okay.
you also see all your other classmates session as well, which will be projected outside from the counseling room. So after every session, we'll have a feedback round where your professor, the scholars, and all the classmates give feedback to each other after the session. It's
Mhm.
very extensive, but we have learned a lot about counseling in that.
So just I would like to here interrupt you. You told the counseling. So when we talk of counseling things and the psychology, so in my mind it comes like mental health and all. So you guys will be also trained from the mental health perspective, how to
Yes.
see these the rising days we are facing so many mental health issues. So what's initiative any I mean or any project or you did enough from our department?
Like as I said, the next year we have a term paper and the
Okay,
dissertation.
okay. And
We go.
I mean, which kind of counseling you guys do? I mean, it is only mental health or person is going through something. So how you guys are trained?
So we are trained according to a model called Egan model, which
Okay.
is like there are different models or like different approaches in counseling.
Hmm.
Where in our department, Egan model is learned, like they
Okay.
taught it. It's very
Okay.
extensive. For
Hmm.
any type of problem, that model is applied to deal with the client.
Okay.
Like
Okay.
we deal with many problems, even like for career counseling, even for someone who needs to go through a surgery, someone who has cancer, someone who has stress or depression.
Okay.
In
Okay.
all these areas, the same model can be learned and applied according to the the patient's needs.
Hmm. That's very nice. And coming to the next thing, the practical approach you also learn in interns. I mean, as an intern, and Hyderabad being the health city, this vaccine city of the world. So you have lots of lab. If I could recollect, we have Ready Lab and so many that I may not be aware that much. So definitely there is a good chance if you are pursuing masters in health psychology from here, so you will good idea of internship. So can you just enlighten us about the internship, how you do intern and how to apply and how's your going on? You are also doing internship right now, correct?
Yeah, so the internship is like just after the fourth year when we have a semester break for like 2 months.
Hmm.
It's a compulsory course that we have to do an internship.
Okay.
It's our choice. Even we can do it our hometown. As you mentioned, there are people who might be coming from Rajasthan, Delhi, or different
Exactly.
places, right?
Exactly. Yeah.
They can do in their hometown, but
Okay.
a complete report of the internship should be submitted to the department at the end of the semester.
Okay. Okay.
Okay, so there is a format that is given where for each case you have to take a case history. There's a form you have to fill for each case.
Hmm.
Like that, a limit of cases will be given. You have to do that many number of cases in the term of internship you're doing. And while talking about the applying of internship, as it is something through the university, from the head of the department and the professor, we will get a letter to
Hmm.
allow us to do an internship at the
Okay.
choice of place we like. So
Okay.
a letter will be given from the head of the department so that we can submit at the place where we need. In that way, we can apply. If there are few government institutions like in Hyderabad, there is Edragata or Nipet. For that we have to mail them and attach these letters, and they will definitely revert
Okay.
us back to join the internship.
Okay. Given the reputation of department and all,
Yeah.
definitely they will allow.
Yes.
So yeah, one more thing. So this internship, basically, when we talk of internship, so just job come in our mind. Everybody cannot understand कि internship is the part of your curriculum that is very compulsory. So definitely, when it comes to job, so how internship helps you to get the job, especially in the psychology.
Yeah, so as I mentioned, internship gives a lot of practical exposure to us. One, it will help us to upskill ourselves.
Mm-hmm.
Like what we do in the department is the stimulation. It's a very close surface. But once you go to an internship, the practical exposure that we get is very high, which will help us to, deal with the clients that we, face.
Mm-hmm.
That is point number one. And point number two, it helps us to build a lot of connections, which might help us to get a job later. And also,
Okay.
there are few hospitals where there is a need, and
Okay.
if the performance of the of us is very good, there are high chances that they might recruit us later
Mm-hmm.
because they'll be having all the information of us.
And what I found, once you get the good exposure, greater experience, you have, I mean, some name and fame, you can also start the online counseling and all. That is
Yeah.
also could be the part of, I mean, your job.
Yeah.
Apart from this, the HCU, what I came to in mind, if somebody has to look for health psychology from your, I mean, ideas or learning, whatever you did, so where people should, I mean, get admission, especially in India, apart from the HCU, any good institutes?
In India, health psychology is only present in Hyderabad Central
See,
University.
that's the great thing. So only in Hyderabad Central University. It's
Yeah.
it's not in JNU or BHU, no.
No.
Oh my
Health
God.
psychology is only in Hyderabad Central University. If someone is really interested to pursue a lot about health psychology, like in this particular branch of psychology, and then HCU is the very good option that we have in India.
Okay, okay. Because
I,
most of the I think medical science students join it, so they better go for their medical practice rather than this. That's why there is very limited number of institutions in India.
yes, yes. Actually, health psychology is a branch that is, very extensive in USA.
Okay, okay.
Yeah, so the opportunities in USA are very high for health psychology compared to India, because in India it's still developing and growing. The branch has been, started to grow through time.
That's very nice. Now we are almost at the end of the talk. I have one more doubt. See, what's after MSc हेल्थ साइकोलॉजी, अगर कोई MSc हेल्थ साइकोलॉजी कर ले तो उसे आगे क्या करना चाहिए, या उसके लिए जॉब के ऑप्शन हैं, या फिर PhD करे, रिसर्च एसोसिएट करे, सो व्हाट नेक्स्ट?
So the first one is, yes, they can start their own practice or look for a job.
ओके.
The second is, there is MPhil for psychology. It is not removed for psychology because it is a licensed course.
ओके.
We have rehabilitation psychology and clinical psychology for psychology people, which is an MPhil course which will provide an RCI license,
ओके.
which is called Rehabilitation Council of India, which provides license for people after completing their MPhil in clinical or rehabilitation setting. It is more of a clinical exposure that is
ओके.
given in that 1.5 or 2 years after, like, which are in eminent institutions like NIMHANS. These institutions have MPhil, like the government ones. So that is one more option. And yes, directly some people can apply for PhD and do research. And yeah, and as you also mentioned, there is need for research assistants as well. They can go in that stream also. So there are, and many people try civils as well after their masters in the branch of psychology. So the options are open, and the requirement of psychologists are very high right now in India, because
Definitely.
like the mental health
Exactly.
has been, yeah, like everybody is knowing the importance of mental health right now, and people are actually breaking the taboo and wanting to take therapy or counseling.
One more last thing I would like to add. I mean, people pursuing from HCU, especially University of Hyderabad MSc. So, what about this letter of recommendation and all people if you want to pursue PhD from foreign? So,
Yeah.
how it goes?
Yeah, like the head of the department and all the professors do give the letter of recommendations, like for everybody. And it is really helpful for them to, because this being a very eminent institution, the letter of recommendations are very much useful for people who want to apply abroad. There are many of our seniors who have been going to PhD for abroad, like 4 or 5 people I know, like in the 2 years, who
Exactly.
left abroad for their PhDs, and they're I mean, they are very in good institutions right now.
Yeah, because this course need I mean a higher education, you need a better research, you need a better position. Definitely you should look for the research from foreign, and HCU is very good platform for the better exposure. You will
Yes.
get LOR and all. So Divya, I think from my side almost we have covered everything from our department to number of seats, क्या यहाँ fee हैं, course हैं, and आपने सब कुछ बता दिया very clearly कि क्या future है. Now coming to the last thing, how would you I mean just remark our HCU campus as a whole from the academics to campus life and a whole?
I think it's 10 on 10 for me.
Oh my God.
Yeah, because the campus life, the campus is so beautiful. You know, you don't feel like leaving it. And yeah, the hostels are good, like not great, but yes, they're good. And the academics are very good because the course, type of courses we have are very good.
Yeah,
So I think it's fun.
and you get a friends from all departments, all
Yeah,
spheres, from all India. It's not
yes, yes.
particular any region.
Yeah, the exposure is very good for us in our campus.
Campus is so live, be it academically, politically, culturally. Every day, every next week, we have a program, some
Yeah.
freshers, some I mean state-sponsored cultural activities and all, and so lush green campus. So Divya, it was very nice talking to you. I hope कि you do way better. And India को mental health की काफ़ी ज़रूरत है. तो you please just incite us and wish you all the best. And thank you everyone. Please share this video among your friends, people who have very less idea कि आगे हमें future में क्या करना है. She has given all kinds of clarification what you have to do, and it's a better opportunity क्योंकि आने वाला future में काफ़ी ज़्यादा इसका demand रहेगा health psychologist की. That I am pretty sure, and Divya will be one of them. तो डेफिनेटली चलो, विश यू ऑल द बेस्ट. चलो बाय बाय, टेक केयर गाइस.
Bye.